Just a few questions. Can you fill me in on the status of the elder abuse public education campaign?
So that was finalized this past fall, and we are proceeding as we think about the movement ahead with the enhanced multidisciplinary team approach, that we would include in that an inventory. We would look at all of the education and outreach going on now so that we can look at what's going on statewide and figure out the next steps to improve that.
You mentioned in your testimony that the EMDTs, the enhanced multidisciplinary teams, had successfully provided effective prevention and intervention services. How do you measure success, or how do you show that?
So there was a formal evaluation that was conducted that actually had specific measures that were included, that was done by an outside federal evaluator for the federal grant project. And so they established those measures. The local teams were required to collect the data, and both through interviews and analysis of the data, they compiled their findings and have produced an evaluation report. That evaluation report was approved by the Assistant Secretary for Planning and Evaluation at the federal level, and is with the Administration for Community Living, and is finalized now for availability to review.
Can you explain the origin of that approach? Was that something that was offered to us by the federal government? I just need a little background on how we got into this. And again, it's in just 2 places at the moment, with the hope of expansion throughout the state.
The federal grant was offered in 5 states, and New York chose a specific model to look at elder abuse prevention and interventions. New York was the only state that chose the model. It was based on a model that was already in existence in Brooklyn, New York, and the idea was to pilot an addition to that, which was viewed as something that would enhance the ability to look at financial exploitation cases. And that was both the addition of a forensic accountant, as well as geriatric psychiatry, and also a coordinator who would help facilitate the work of the professionals that were working on the teams. It was piloted in Manhattan, as well as in 7 Finger Lakes counties. This past year, with support, it was also expanded to other locations. We used 2 sets of funding to have done some expansion work, and that is now going on in approximately 22 counties.
And you said that one of the focuses is on financial exploitation, but not entirely, correct?
So that would, for the enhanced multidisciplinary team pilot, that was the area of focus, but not exclusively. So certainly all forms of abuse were addressed.
Okay, thank you.